Dan. Well, millions of people in the U.S. suffer from hepatitis C, but most of them don't even know they have it. Dr. Michael Charlton is here with us from Intermountain Medical Center to talk more about that disease. Thank you for being here. This is obviously something that we need to be talking about. When you talk, millions of people have something, don't know it. Let's start with the basics. What is hepatitis C?
It's a virus that affects the liver. You get it from blood-to-blood contact. And people born between 1945 and 65 have about 5 times the national average for having it. And most of them don't know what risk factor they have. So it's a silent disease. It affects the liver, and about over 20 or so years, it can lead to liver failure, liver cancer, and death. About 100 people will die in Utah in 2014 from hepatitis C.
Wow. Yeah. And we hear so much about HIV. We hear about Ebola, right? We heard a lot about that. Why is hepatitis C being pushed on the back burner?
You know, it's a good question. We've known about it since 1989. We've known hepatitis C exists. We could test for it. But only in the last year, we've had these therapies. We can cure almost everyone, Nadia.
You can cure it?
We can cure about 95+% of people with just pills for the great majority. So it's easy therapy, very effective. We've had those pills for about a year now. We were hoping we would see the national numbers and the numbers in Utah drop off for the deaths from it. But nationally, 16,000 people, as we draw to the end of 2014 here, about 16,000 people will die. We could save almost all of them if we get them diagnosed and treated.
Okay, so you talked about risk factors being if you were born between 1945 and 1965, 5 times more likely to have it. What are some of the other risk factors?
The other risk factors are any blood transfusion before, say, 1990. Even if you had an operation where you weren't told you had a blood transfusion, you might have had one. Any needle stick injury, injectable drug use, recreational drug use, sometimes snorted recreational drugs. But most people, I want to stress, people don't get screened, I think, because they're worried about what does that say about my past. It doesn't have to have any risk factor if you're born between those years or you just think you should be screened. Take it on yourself. Only about 5% of people who should be screened, we now know this from national figures, get screened. 95% aren't getting screened. 95% aren't screened.
That attributes to that many people who have it don't know about it. What are the symptoms? Is there any way I can tell that I have hepatitis C right now?
You know, if I had it, I wouldn't know. The great majority of people, more than 9 out of 10, have no symptoms. By the time you have symptoms like turning yellow or getting fluid in your belly or pain from a liver cancer, you're really far along in the disease. So most people have no idea. In retrospect, people say when they get cured, boy, I don't have as much tiredness as I had. So people feel often better when they're cured, but they don't realize at the time that they had these symptoms.
I like to hear you use the word cure. If people just get screened for it, there is a cure. You can get this out of your life for good. Should people start asking their doctors about this to get that in that yearly checkup? I mean, who should be asking about this?
That's a great point. If there's one thing to get across today, it's that we need to have our patients take it on themselves to ask their caregivers, their doctors, nurses, whoever it is, to get screened. If you're in that age range or born between 45 and 65, we know from a national study that providers aren't doing it. Somehow the recommendations are out there from the Centers for Disease Control for people to get screened, but it's not happening. That's
slipping through the cracks. So you have to take control of your own health and ask for that screening. Dr. Charlton, thank you so much for being here.
Well, thank you for having me.
We'll put the details on our website at goodforutah.com. Brian, back to you.